Hi, I'm Dr. Lisa Thomson. I am the current president-elect for CalChiro. I am a chiropractor in Santa Fe Springs, California. And yeah, that's me. And I'm a huge sports nerd. Right now with COVID, since a lot of my athletes haven't been playing, it's kind of switched to a little bit, I do see a little bit of personal injury, stuff like that, because I am in Los Angeles, so people are getting in auto accidents still. So I'm interested to see actually what happens because sports are starting back up again. So it was primarily sports. I do still see quite a few athletes. Some of my higher level athletes never stopped playing, of course, but it's not as sports dominant as it was a year ago. Staff a lot, and we had 1 hour that we were trying to fill. We needed 1 hour, preferably a technique class, and we're like scrambling, trying to find somebody. And I was like, wait, I could do an hour of technique. Why don't I just volunteer myself and then we don't have to worry about it? So I did. I was hoping that there would be like 20 people in the room, and there was 130 doctors there. And I was super nervous, but it went really well. And so I'm a soccer player, so it reminded me of that type of performance where the prep is a lot and it's intense and it's intimidating, but then once you do it, it's like, oh, that felt really good. And I was proud of myself, and it took me out of my comfort zone, which helps me grow. I mean, a year before that, I was introducing people at Sports Symposium, and I was so nervous introducing people. So I come a long way. And then most chiropractic events, it's still male dominated. So having sports is even more so. She encouraged me, and I was like, you're absolutely right. Like, it is intimidating. So the more I do it, the more comfortable it is. And so now I'm trying to encourage more females to speak up. So I've kind of transitioned to that because it's true, and it is intimidating. And once you do it and get used to it, it's awesome, and get a lot more respect for it. So it's good. But yeah, that's kind of been my nervous to even introduce somebody, kind of get my toes wet, and now and since there aren't very many females, I'm getting asked to speak quite a bit now. So I started like the functional movement type world and TPI, and I loved it. So it became, I had it in the back of my mind that I would be interested in teaching and speaking at some point, but I didn't know about what. I didn't know what I knew that was special. And so I really dove deep into that world because I loved it so much, and it made so much sense to me, especially as an athlete. And so it became like an excuse to like, well, I need to take more classes, even though I love taking the classes. I'm a huge nerd. Dr. Greg Rose, who's the TPI founder, has a public speaking class that I was able to take. I took that the weekend everything shut down with COVID. So like all my speaking engagements got canceled after that. But it was a great class. They like throw stuff at you while you're speaking, and really intimidating.
That's very useful.
So, I mean, Dr. Greg Rose, first person that comes to mind. He's brilliant, awesome teacher, and just a great human. And then a lot of the other TPI people. So Dr. Sean Drake, of course, has helped me a ton. Those would be my two that come to mind. They've helped teach me a lot and motivate me to. Sean's motivated me and encouraged me to step up. Sue Falsoni, I could listen to all day. My office is, I think it's pretty cool. I have a big net set up in my office so I can watch my athletes swing, hit, throw, whatever it is they do. So I will do a couple different things depending on their sport. So if it's a golfer, for example, or a baseball player, I'll have them come in. I will screen them using either the TPI screen, or if they're a baseball player, On Base U has hitting and pitching. So I will screen them so I know what their physical limitations are. I also have the K-Vest in my office, so I can hook them up and I can see their kinematic sequence and what's moving, how it's supposed to, what's not, are they bending right, all that fun stuff. And then I will treat. So if we can't fix the limitations, we're going to have to work around them. So most people want to try and fix them first. So I'll treat. To be honest, sometimes I'll have whole teams want to be screened, so it's easier for me to go to other facilities. There's a facility really close to my office that trains a lot of athletes. They have a lot of really high level, especially basketball players there. So I will go to them sometimes, and then I can screen a couple people at a time and just go, and have, yeah, that's a little bit non-traditional. So I usually have interns at my office. So I will try and bring an intern, and that way I can teach them, and it's a fun, unique setting too, especially the students who are interested in getting into sports. It's a little bit different than just treating injuries. So I'll usually have an intern with me, something like that, at least to help with the paperwork and the screening. And I would love to see more of us being the first go-to with injuries. It's just, I mean, obviously as a chiropractor, it's a no-brainer. Like, try the non-invasive stuff first, try the non-drug approach first. Uh, I'm I'm assuming and I'm hoping that that's the direction it's going to go. It just makes sense that I think with the opioid issues that are going on, people are starting to see that, oh, maybe traditional just go to the medical doctor for my pain isn't the first thing I should do. So really hoping that that's the direction it goes. And I think that'll open doors for everything. The more exposure we have, the more people will see how awesome chiropractic is, and it should just grow and spread from there. Blame that, or if I'm not busy, I'm bored. So, oh, in 5 years from now. As far as education goes, I have little kids, so a lot of my seminars and stuff have only been weekend seminars. It's been harder for me to jump into something like a CCSP or a diplomat, but that interests me. I never want to stop learning. If I could take this stuff for free, I would be learning, taking classes every single weekend.
Yeah,
I have both kids in school now, so I can focus more on my practice and growing my practice. I have a big empty space in my office, so I'd love to grow it a little more. I'm not 100% sure what I want to do with it yet. If I want to have just an area for my athletes to have more space to swing and stuff, or
he's doing it with military. So it's really exciting. Yeah.
it'll all come together.
Yeah.
Yeah, it should be a great lineup. I'm sure you saw the email that